Introduction. In the field of ophthalmology, retinal detachment is considered a serious and potentially sight-threatening condition. It occurs when the retina, which is the light-sensitive tissue at the back of the eye, separates from its underlying supportive layers. Retinal detachment can be caused by various factors such as trauma, aging, or underlying ocular diseases. Understanding the molecular mechanisms, pathological changes, and optimal treatment strategies for retinal detachment is crucial for providing appropriate patient care. Retinal detachment occurs when the vitreous gel abnormally pulls on the retina. This is caused by complex molecular mechanisms involving molecules like fibronectin, laminin, and hyaluronic acid. Myofibroblast contraction in the vitreous also contributes to retinal tears and detachment. Understanding these processes can lead to targeted interventions for prevention and treatment. Cytokines and growth factors are important in the development of retinal detachment. Inflammation, new blood vessel formation, and scarring are all influenced by these molecules. VEGF promotes abnormal blood vessel growth, which can contribute to retinal detachment. Elevated levels of IL-6, TNF-alpha, and IL-8 in the eye fluid of patients with retinal detachment indicate inflammation. Identifying the specific functions of these molecules can aid in developing treatments for retinal detachment. Retinal detachment with tears or breaks, rhegmatogenous, involves subretinal fluid flow. This fluid contains substances like prostaglandins and leukotrienes, causing subretinal fibrosis and degeneration. Analyzing fluid composition helps develop interventions to prevent or reverse detachment. In retinal detachment, dysfunction or loss of retinal pigment epithelial, RPE, cells can cause detachment. RPE cells support photoreceptors and remove their outer segments. Disrupted RPE integrity leads to photoreceptor degeneration and detachment. Understanding RPE dysfunction may guide treatment approaches. In retinal detachment surgery, pharmacological agents like corticosteroids, NSAIDs, and anti-VEGF drugs are used to prevent inflammation. Evaluating their effectiveness and safety is crucial for patient outcomes. Studies have assessed their anti-inflammatory effects and potential risks. Knowledge of these agents can help clinicians make informed treatment decisions. In the video, we will compare the surgical outcomes and complications of using 23-gauge and 25-gauge pars plana vitrectomy, PPV, systems for retinal detachment repair. Understanding these differences can help surgeons make informed decisions for their patients. In this section, we will explore the use of optical coherence tomography angiography, OCTA, in assessing retinal vascular changes related to retinal detachment. OCTA is a non-invasive imaging technique that helps visualize and assess retinal blood flow and microvasculature. By analyzing retinal perfusion, vascular remodeling, and neovascularization, OCTA provides valuable insights into the pathophysiology and progression of retinal detachment. Incorporating OCTA into diagnostic and treatment strategies can improve our understanding of the disease and potentially enhance therapeutic outcomes. Macula off retinal detachment poses challenges for achieving good outcomes. Factors such as duration of detachment, macular hole formation, and pre-existing eye conditions can affect surgical success and visual recovery. Identifying these factors aids in predicting prognosis and guiding treatment strategies. In assessing the success of retinal detachment surgery, it is crucial to evaluate both visual outcomes and quality of life. Various tests and questionnaires have been utilized to determine postoperative functional outcomes and patient well-being. Understanding these long-term consequences can inform patient care and support. Intraocular gases play a crucial role in managing complex retinal detachments, especially those with proliferative vitreoretinopathy or giant retinal tears. A systematic review and meta-analysis shed light on their effectiveness, complications, and optimal usage for successful retinal reattachment. Surgeons can make informed decisions for better patient outcomes. Inherited retinal detachment is a rare but significant condition that can be caused by various genetic mutations. Understanding the genetic variations associated with inherited retinal detachment is essential for improving diagnosis, prognosis, and therapeutic options. Several genes, such as RHO, CRX, and RDH12, have been implicated in different forms of inherited retinal detachment. Genetic testing and counseling can help identify individuals at risk, enabling personalized treatment approaches. Exploring the molecular mechanisms underlying these genetic variations can provide insights into potential targeted therapies and gene-based interventions for inherited retinal detachment. The timely detection of retinal breaks or tears is crucial for effectively managing retinal detachment. Several imaging techniques, including fundus photography, OCT, and ultra-widefield imaging, have been developed and are continuously being improved to identify these subtle retinal breaks. Furthermore, the emergence of new imaging techniques, such as adaptive optics and multispectral imaging, shows potential for further enhancing the detection and monitoring of retinal breaks or tears. Understanding the capabilities and limitations of these imaging modalities helps clinicians in choosing appropriate methods for diagnosing and managing retinal detachment. In conclusion, retinal detachment is a complex eye condition that requires a deep understanding of its causes, changes in the eye, and optimal treatment approaches. Through this video, we have explored topics such as vitreous traction, cytokines and growth factors, fluid changes, and surgical outcomes. We have also discussed advanced imaging, genetics, and long-term vision results. Advancing our knowledge in these areas will enhance patient care.